Let's get you the latest now coming in from India. According to the information released by the Health Ministry, the country has yet again recorded its highest single-day surge in coronavirus cases. More than 32,000 people have contracted the highly contagious virus over the last 24 hours, and 606 people have lost their lives since yesterday. To understand the trajectory of the pandemic in India, we at WION have collated the data of the last 10 days. The graph on your screens clearly shows that India is recording its highest daily surge almost every day. Let's understand the trajectory of the deaths due to COVID-19. While the deaths are proportionally far less when compared to the cases, the graph on your screen shows how a steep uptick is happening. Let's now tell you about the worst hit states in India. Maharashtra, Tamil Nadu and New Delhi continue to remain worrisome. COVID-19 situation in Maharashtra is currently the worst in the country. The state has reported more than 275,600 cases and nearly 11,000 fatalities. Tamil Nadu is the second worst affected state with over 151,800 infections and more than 2,100 COVID-19 deaths. The national capital of Delhi has also witnessed an alarming increase in COVID-19 cases. The region has recorded nearly 117,000 cases with over 3,400 fatalities. The pandemic is wreaking havoc across the nation. But we would like to tell our viewers that the recovery rate in India is currently at 63.25%, which is more than 600,000 people who have recovered after contracting the virus. As India grapples with surging COVID-19 cases with the limited means to fight back, the Indian Medical Association estimates this suggests that almost 100 doctors have died due to COVID-19 and 1,300 are still infected. Out of the doctors who died, 52 were general practitioners and 45 specialists who were possibly infected by someone unaware of being a carrier. The IMA has issued guidelines to protect the health of doctors. It says all the administrative setups in hospitals will have to be updated, including infection control protocols. Any gap in providing for the safety of doctors, nurses and staff will have to be plugged. It further said providing for PPE and physical distancing and sanitizers should be monitored on a daily basis. Operation theatres, labour rooms, laboratories and casualties would require special care. Routine exposure to non-sanitized equipment and long hours makes healthcare and frontline workers particularly vulnerable. As the virus struck, even doctors were baffled and independent practitioners stayed away from their clinics. Many of them now prefer to treat patients through telemedicine, and the government issued guidelines for telemedicine on the 25th of March, the day it announced a countrywide lockdown that ended almost 2 months later.